Mary Jean, let's get started.
Good morning, everyone, and welcome to this very special program today. I'm Mary Jean Jakubowski, and I have the honor and privilege of being the director of the Buffalo and Erie County Public Library. You know, this week, April 5th through April 11th, is National Library Week, but it's also National Public Health Week. And I cannot think of a more appropriate guest and wonderful guest for the library to have this week than Erie County Commissioner of Health, Dr. Gale Burstein. Now, before we get started, just some quick housekeeping. Everyone watching will be muted during Dr. Burstein's presentation to avoid distractions. If you have a question, please type it into the chat box, and we will get to as many as we can once the presentation has concluded. This program is being recorded. You will be able to watch it again later on the library's Facebook and YouTube channels. And now I am so very honored to introduce our guest and friend, Dr. Gale Burstein. She is the Erie County Commissioner of Health and received her medical degree from the University of Buffalo School of Medicine, as well as a master's degree in public health from Johns Hopkins University in Baltimore, Maryland. Dr. Burstein's primary focus for over a year on public health efforts to control COVID-19. She's led Erie County's response to the COVID-19 pandemic in managing Erie County's epidemiology office, public health lab testing, diagnostic and antibody testing clinics, enforcement activities, public communications, and just in this past month, coordinating the COVID-19 vaccine sites. She is also responsible for supervising Erie County's efforts to expand substance abuse prevention and treatment services, improve adolescent sexual health care services, decrease the number of childhood lead toxicity cases, improve HPV immunization rates, and prevent opioid-related deaths, amongst many other public health services. I'd like to take just this moment to thank Dr. Burstein for your outstanding leadership during the pandemic, which of course, as we all know, is not yet over, when likely there will be more challenges yet to come. We're so glad to have you in our corner. Your guidance and calming demeanor have been essential during these most difficult months. I personally thank you. We appreciate you speaking with us today. Welcome, Dr. Burstein.
Wow, well, thank you. Thank you for that very warm introduction. So in honor of Public Health Week and Library Week, I am going to be speaking about public health to the Erie County Library audience. So this first slide is just overall presents a graphic from the American Public Health Association, just listing kind of all the components of public health. So, and you know, under the big umbrella in public health, we work towards assurance, assessment, and policy development, and there are components for each of those. So it's public health is probably more complicated than most people are aware. And you know, I just want to encourage people, if you're thinking about a career or additional studies, taking any type of public health courses or getting a master's in public health is really beneficial and really helps you look at the world with a different lens. So I will advance the slides myself. So I guess the first question we should answer is, what is public health? And I am drawing from Charles Edward Amory Winslow, his definition. And he is a leading figure in the development of modern study of public health. And his definition of public health was developed almost a century ago, and it is still relevant today. And his definition is the science and art of preventing disease, prolonging life, promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. So again, it was true 100 years ago, and it is still true today. So I think many people are confused between the difference between public health and what we do in healthcare. I know that when I talk to people about public health, they think that it has to do with occupational health, and but it's really very different. In public health, we really take a look at the entire population and see how we can improve the health of the entire community, or the state, or the country, or whatever population we're focused on. Whereas healthcare, they're really focused on their individual patient's health. We're trying to get healthcare to expand and look at their whole patient population's health. But really, the way that acute care medicine works is looking at an individual patient's health. In public health, we emphasize prevention. That is the most efficient way to stay healthy, is prevent disease, which I'll talk about a little bit more. And in healthcare, they emphasize really secondary prevention, which is emphasizing the diagnosis and treatment of a disease rather than preventing it. We're trying to get to a more prevention-focused healthcare system, but I think we all realize we're not quite there yet. And then also, public health is really an entity in the public sector. Usually it is government directed, or many times it can be in academics. Whereas healthcare, oftentimes it's a private sector. I mean, many providers are in private practice, and it's actually a business. We do have healthcare that is run by governments, such as, or funded by governments, such as federally qualified health centers. So those are they're not government agencies. However, they are funded, or they receive supplemental funds from governments. And then as some counties offer clinical healthcare services, like in Erie County Health Department, we'll offer, we have an STI clinic and a family planning clinic, which we call under our umbrella of our sexual healthcare clinic. We offer TB healthcare services, and then also immunization services. However, our main charge is actually keeping the public safe and healthy. So public health is really given us a lot of opportunities to have a great quality of life here in the United States. And I think that most people take much of what public health is responsible for granted, because that's our norm now. So because of public health, we have clean water and sanitation, antibiotics. Hopefully we're using them smartly. We're using too many antibiotics right now, so we're trying to pull back on that with good antibiotic stewardship. We have safe food. We have lead poisoning prevention programs, to keep our kids healthy. We have vaccines to prevent vaccine preventable diseases. We've come a long way with maternal and child health improvements. We've increased life expectancy, and we've also improved the workplace safety. So public health has been responsible for a lot of efforts that I think we take for granted right now. So, and then also, and just in terms of when if you have any people that are listening and at the point where they're considering careers, either starting a new career or thinking about a change of career, there is a wide variety of careers that people can take in public health. And this lists just some of them. There are researchers, scientists. We hire contact tracers here at the health department. We also have public health sanitarians that we work with to inspect food facilities and in other facilities that are permit-based. We develop policies for government. We employ physicians, nurses, first responders, health educators, lab technicians, and statisticians, epidemiologists. We don't employ any occupational health and safety professionals. However, that is a career in public health. There's also nutritionists, dietitians, and also what we're working with right now are our disaster management and emergency preparedness group. So that they are very, very busy right now. So I just want to talk about our approach in public health, how we address a public health problem. So So public health problems, are very diverse, and they can include infectious diseases, chronic diseases, emergencies, injuries, environmental health problems, as well as other health threats. And regardless of the topic, we take the same approach to the public health problem by following these general steps. So first we have to ask, so what is the problem? And in public health, we identify the problem by using our surveillance systems to monitor health events and behaviors occurring among the population. So for example, with our pandemic, it was surveillance systems that helped us pick up that we do have COVID-19 in the United States and in Erie County. So, and then the next question is, after we've identified the problem, what is the cause of the problem? So, for example, are there factors that might make certain populations more susceptible to disease, such as something in the environment or certain behaviors that people are practicing or certain age groups? And so, for example, with COVID-19, we know that there are certain risk factors for developing more severe illness with COVID-19, such as age, certain other comorbidities. We also know that, people who are struggling with the outcomes of the social determinants of health, people are struggling with, poverty, poor housing, though they also, in crowded housing, they also are more at risk of getting infected with COVID-19 and outcomes of COVID-19. So once we've identified the risk factors related to the problem, we ask what intervention can work to address the problem. So we look at what has worked in the past, looking at evidence-based approaches in addressing the same problem, and if a proposed intervention makes sense with our affected population. So in the last step, we ask, how can we implement this intervention? Given the resources that we have, what we know about the affected population, will this work with our problem in our population? So, and then we want to make sure that we can prove that it works. So, we want to assess if we can make the intervention work better. So we take on evaluation at that point. So during this talk, you'll see different examples of our public health approach to solving different public health problems. So there are different flavors of prevention, right? And wouldn't it be better if we didn't have these problems at all and we can prevent them? So there are three types of prevention. Primary prevention, so which is, stopping the problem before it even happens, preventing the injury, say, for example, seatbelts, wearing helmets, or preventing disease, which by getting vaccinated, say for COVID-19 or other vaccine preventable diseases. Secondary prevention is reducing the impact of the injury or the disease. So for something like opioid epidemic, for people who are struggling with opioid use disorder. And so once they already have the disorder, secondary prevention would be starting them on medication-assisted treatment. For COVID-19, secondary prevention would be, giving individuals, specific, monoclonal antibody therapy or some type of treatment that is specifically for COVID-19. So once they're already infected, they'll have an easier course. And then tertiary prevention is managing the long-term outcomes. So if, say people do have an injury, they're in a motor vehicle accident, they recover, but they still have deficits. So, managing that. With COVID-19, we know we have, unfortunately, people who do recover, but they don't get back to their pre-morbid state. So that we call those the long haulers. So, trying to help them manage with their long-term conditions from COVID-19. So again, there's not just one flavor of prevention. So an example with diabetes, with primary prevention is education to promote healthy eating and exercise to reduce risks of developing a non-insulin dependent diabetes. Secondary prevention, so once people are diagnosed with diabetes, putting them on exercise programs and offering workplace wellness initiatives to make sure that their, pre-diabetes doesn't develop into type 2 diabetes, or if it does develop into type 2 diabetes, that, they keep their blood sugars under control. And then tertiary prevention is in-person or virtual support groups for individuals living with type 2 diabetes, diabetes. So, they understand how to live in incorporate lifestyle changes to keep them healthy with given their type 2 diabetes. So, public health isn't just the health department alone. For us to be effective, we really have to rely on our partners because, public health, we have limited resources, we have a limited labor force. So we really need to rely on our community partners, which include business and industry, other government agencies and elected officials. We do a lot of collaboration here at UB and our other colleges and universities, just in terms of implementing some great projects and also doing research and looking and helping us evaluating our interventions. Our media is a huge partner. Helping us disseminate the message is very, very important. Also, looking at people who are influencers, people who are leaders in the community to help carry our message around public health prevention. And we're really relying on that for our COVID-19 prevention efforts, and really relying on the media and our on leaders in the community that people look up to and trust to help people understand about the importance of adhering to good preventive measures and getting that COVID-19 vaccine. We work with the general public, making sure people understand what we're saying and adhere to what we're recommending. And then, of course, we look very closely with the healthcare world. So with our clinical providers to make sure that we're all on the same page and we're really complementing each other to keep our community healthy. So the Erie, just like many other entities, the Erie County Health Department has a mission, and it is to promote and protect the health, safety, and well-being of Erie County residents through active prevention, education, enforcement, advocacy, and partnerships. So, and this is just to say that we do more than just education and providing information. We also have an enforcement arm, as we've seen during this COVID-19 pandemic. And then we also tried to work with our elected officials to educate them so they can enact laws to help keep us healthier. Like our Clean Indoor Air Act is a great example of that. So our Erie County Health Department has, again, a variety of offices and services to keep our community healthy. We have our epidemiology and disease prevention, and so they're the folks working on our surveillance systems, specifically with COVID-19. Helping us find out, determine, how much COVID-19 we have in the community, who's affected, the age groups, the areas in Erie County, the municipalities that are most effective, any race, ethnicities that are most effective. So our epidemiology office provides us with those data. And then we have a really important environmental health division. And so they are our enforcement arm. So they've been the group that has been, as well as doing on in a non-pandemic situation, they do the restaurant inspections, making sure that everybody has safe food. They work on our rodent control programs, our rabies control programs. It's getting to that season again where we're going to start to see bats flying around and people perhaps having a bat encounter where they need rabies vaccines, and so our public health, our environmental health folks do a lot of work behind the scenes, both with permitted programs and non-permitted programs. They're also the group that works on our lead prevention programs. Everybody knows of our early intervention special need programs, to help give kids an extra who are a little bit developmentally delayed or significantly developmentally delayed, give them resources to be able to catch up and do well. We have our Public Health Emergency Preparedness Division, and they have been working very, very hard during our pandemic. They have been running our testing programs, our specimen collection for our testing, and they right now have a huge responsibility of running our vaccine programs for the county. So they're running our COVID vaccine program and doing a great job. This week so far, we've been vaccinating more than 2,000 people a day. So they've been very, very busy. We also have our public health lab, which is only one of 3 public health labs in New York State. The other is Albany, in Albany, Wadsworth Public Health Lab, which is run by the New York State Health Department. And then New York City has a public health lab. So and we have a biosafety lab of level 3. So if you have the misfortune of receiving an envelope that has white powder in it, we have our biosafety lab level 3 can analyze that white powder and make sure that you weren't exposed to anthrax or anything terrible. Also, we are part of CDC's Laboratory Response Network. So we receive laboratory tests directly from CDC, before the private labs or commercial labs or university labs might be able to develop their own. So, for example, we received our COVID-19 tests directly from CDC. And then if you remember back to the H1N1 outbreak, we were also able to receive our H1N1 tests directly from CDC. So we have a great partnership there. And then we have our medical examiner's office that investigates all suspicious causes of death. And unfortunately, they have been so busy the past couple of years with our opioid epidemic, and unfortunately, conducting the autopsies to provide us with information about these suspicious deaths, suspicious overdose deaths, and confirming if they were overdose deaths, and also telling us what drugs were in those toxicology screens at the time of death, so we understand what drugs are out there in the community killing people. Unfortunately, they also do the autopsies on children that have died that were not under the care of a physician, helping to investigate for abuse and neglect, and then also they do the autopsies and investigations on gunshot wounds, which unfortunately they've been so busy this year with investigations around autopsies with gunshot wounds. There's just been a lot of violence in our community lately. So we have a very diverse workforce in the Erie County Health Department. So let me just talk about epidemics and pandemics and what the difference is, because, when I refer to our COVID-19, it's called a pandemic. But however, when I refer to our opioid problem, we refer to that as an epidemic. So an epidemic is where we see an increase in the number of cases of a disease above what is normally inspected in that population in that area. Whereas a pandemic is an epidemic that is worldwide or crosses international boundaries. And we know that COVID-19 is a global problem right now. And so we refer to COVID-19 as a pandemic rather than a localized epidemic. So as I alluded to earlier, the health department has many of the different offices and division in the Erie County Health Department has been very involved in responding to COVID-19 pandemic. This has really been an all hands on deck operation. As I mentioned earlier, our Office of Epidemiology is working on looking at our surveillance data, analyzing that data. They also do our contact tracing. So they investigate all the cases that we receive of COVID-19 through surveillance, and make sure that we try very, very hard to reach out and speak to every single COVID-19 case. And right now, as you know, that we're every day we're receiving between 400 to 500 reports of new COVID-19 cases from the state health department. So they are very, very busy. So we try to speak to every single case. We interview them, find out who their close contacts are, and we make sure that those individuals individuals who have COVID-19 are placed in isolation, and they understand what that is. And then we also make sure that we contact people that that cases have identified as close contacts, make sure that they're aware that they've been exposed and they need to be in quarantine for 10 days, and also strongly encourage them to get a test 5 to 7 days after their last exposure. We also, within our contact tracing team, and we have a school team that specifically investigates cases that are in grades pre-K through grades 12, and then also work with colleges and universities. So they're just devoted to making sure that the schools stay healthy and everybody in that school is a safe place to learn. Our public health lab, as I mentioned, is gets a PCR testing for COVID-19. We also do a lot of STI testing and environmental testing. Waste. We test the water from the beaches. We also do a lot of other environmental testing with the water for when people buy a new property or selling their property, for property transfers, if people have wells or septic systems. We also do the testing on our lakes in New York State that are around us to look for algae blooms. So our public health lab is very busy, because on top of COVID-19, we still have all these other laboratory tests that our public depends on, that we need to run. We're also doing COVID-19 antibody testing. We put a pause on that because now that people are getting vaccinated, we don't really know if the antibodies are from people who had an infection or people who were vaccinated. So we put a hold on antibody testing for COVID-19 for now. As I mentioned earlier, our environmental health workforce, they're working on enforcement. So if bars or restaurants were in violation of the New York State executive orders, we would first we educate. If we receive a complaint, we call up the facility and do some investigation over the phone, find out what's going on. We educate the facility, making sure they understand the rules that they're supposed to be following. And then we may go out there and inspect. If we still see violations, that the restaurants or bars aren't following the guidelines set out by New York State Health Department, we'll provide some education on site, and we'll have them correct what they can immediately. And then, ultimately, if there are repeated violations or egregious violations putting people's health and safety at risk, then we may have to close those facilities. But that's really a last resort, and we've only had to do that a few times during this pandemic. If we do have to close a facility, what we do is make sure that the facility writes a good safety plan for their reopening, and as soon as we can approve that, we make sure that they reopen in a safe environment, so people that are enjoying their food or enjoying the bar will be able to be safe, while they're dining or drinking. We, all this all these interventions take money. So we have a very busy accounting office right now. We also, health communication is very, very important. The Erie County Health Department wants to empower people with information so that it'll help them make smart choices to stay healthy, including for COVID-19. So we've developed a COVID-19 call center, 716-858-2929. So people can call that number, and if they have questions that they can't get the answers from on our Erie County Health Department COVID-19 website, and I'll give you the URL later on in this talk, then they can ask questions. Also in this call center, they can make appointments for vaccine, and they can make appointments for testing. Also, we are our public health emergency preparedness, our emergency medical services unit. They've been very, very busy, leading the charge in this pandemic. So as I mentioned earlier, they are collecting all the specimens for our diagnostic testing, both the rapid testing and the PCR molecular diagnostic testing. So they're collecting the specimens for that our public health lab runs for the PCR testing, and they're doing the rapid testing on site. Also, also when we were doing antibody testing, they were collecting the blood for that. And as I mentioned, they are running our vaccine points of dispensing, or our vaccine clinics, which they are very, very busy right now. Planning those, figuring out, how many, with the doses that we receive from the state, planning where we're going to dispense them, and how, with the staffing that we need. The scheduling system is very complicated, so it's never easy. And also, we work very hard to coordinate with other county departments and also with the New York State health departments, because they're very strong partners. So we've been, especially at the beginning of the pandemic, this was really our response to COVID-19 was really an all hands on deck response, with all branches of Erie County government working together to make sure that our community stays healthy. And we really want to thank them. And then also the New York State, they write many of the policy and guidelines that we implement ourselves, and we help our community implement, so we can stay safe and healthy, including in COVID-19. So, again, some examples of different flavors of prevention with COVID-19. So primary prevention. So remember, that's preventing the disease from even happening. So that is, so what we do for prevention of COVID-19 infection is, we all know, wearing masks, double mask if you can, social distance, 6 feet or more, and then vaccination is very, very important. And also keep, staying away from sick people. So, making sure that sick people don't enter your space. Secondary prevention. So if, people do fall ill with symptoms of COVID-19, getting a diagnostic test, or a screening, or a screening if they have symptoms, asking them some screening questions to see if they are likely to have COVID-19. And then if they are diagnosed, then putting them in isolation. And then tertiary prevention is working with contact tracing, finding out who else was exposed, and putting those people who are close contacts into quarantine, and recommending testing. And that is to reduce transmission within the community. So break the chain of transmission. So that's what primary, secondary, and tertiary prevention look like during our COVID-19 pandemic. So just some examples of some policies that may be implemented, that are public health policies. So for example, in COVID-19, the New York State Health Department really develops many of the policies. So there have been mask requirements in businesses, schools, and other settings. There are COVID-19 requirements for, say, before, people visiting nursing homes. There have been COVID-19 testing requirements for schools to remain open. And then the isolation and quarantine order. So that's a combination of New York State and local health departments working together on those. So just some looking at some type of public health interventions using COVID-19 as an example. So looking at our surveillance data, so collecting that data from the state health department's eCLAIR system, which is the electronic clinical laboratory reporting system, where all positive test results for a communicable disease are entered by laboratories that have our license to operate in New York State into the New York State eCLAIR system. And then New York State sends those test reports to each of the counties where the person who tested resides. So that's the same with COVID-19. So we receive from the state health department all the positive and negative COVID-19 test results. So we not only know the number of people and who were infected, we know the proportion of tests that were positive. And also because if all of a sudden we start to see our numbers of COVID-19 cases increase, if, that could be because there's more disease in the community, or more people are getting tested, or a combination. And if we don't know the number of negative test results, we're not going to know, why we may be seeing an increase. So our epidemiology office looks at those data, looks at those reports, and lets us know, the magnitude of the disease, the burden of the disease, who's affected, what the risk factors are, and then we use that to target our interventions. And so another intervention that we offer is free diagnostic testing for COVID-19, because if people don't know their status, they can be walking around with COVID-19, whether they have symptoms or not, and then infect other people around them, especially people they live with, or people they work with, or people they go to school with. So even COVID-19 testing is an intervention to reduce the burden of COVID-19 in our community. We've also, with our emergency services and public health preparedness team, we've been very active in distributing personal protective equipment, especially masks, hand sanitizer, wipes throughout the county. And then I think what was really important right now that we're all focusing on right now is vaccination as a very important intervention to reduce our burden of COVID-19 in our community. A vaccination is going to be our ticket out of the pandemic. So just want to give you a little bit of an update on what we've seen for COVID-19, and these data are as of April 4th. So on our Erie County Health Department website, we have many dashboards, so people can see the number of confirmed cases in the county so far, the number of residents in Erie County that have had at least one dose of the COVID-19 vaccine. And then we have also on there another tab where you can see the number of people that are fully vaccinated, either with 2 doses if they received the Pfizer or Moderna vaccine, or just with 1 dose if they were able to receive the Johnson & Johnson vaccine. And then also we look at, unfortunately, our deaths. We look at the number of cases and the rates by zip code and by municipality. And so we have that on our website. We also look at the total number of confirmed cases over time, so we can see where we are in our pandemic. And that's in the box on the upper right-hand corner. And so you can see that, even though in the beginning of the pandemic, we were so scared because we thought we had, all these cases and it was very, very concerning. Right now we still have a lot of cases. We know in the late fall and during the winter we saw a surge of cases, and you can see that in the end of 2020 and the beginning of 2021, and then after our Christmas holiday surge, our numbers started going down, and as we started vaccinating more people in our community. And then lately we've started to see another wave of a surge of cases. And so, unfortunately, I know we all want the pandemic to be over. We all want COVID-19 to be over. But you can see from this box on the upper right-hand corner of the slide that the pandemic is not over yet, and we still have high numbers of cases. Also, through our public health surveillance systems, we have information about hospitalizations for COVID-19. And so this slide is looking at the hospitalizations in the hospital of Erie County, in the hospitals in Erie County, from when we started at the beginning of the pandemic in March 2020 to the present. And so the blue line is looking at the total number of Erie County hospitalizations for COVID-19. And the red line is looking at the number of people who have been hospitalized in the intensive care unit for COVID-19. Over the x-axis is looking at dates over time, and the y-axis is looking at the number of patients. So you can see, if we remember at last year in the spring, our hospitalization numbers grew very, very quickly, and we were worried we were going to run out of hospital beds. We were worried we were going to run out of ventilator beds and ICU beds. And the hospitals pivoted, seeing these data, helped us all realize as a healthcare community that we were going to get into big trouble soon if we didn't make some changes. And so the hospitals were able to pivot and make sure that, hire new staff or reassign staff, and they were able to close down some non-acute operations like elective surgeries, and really focus on staffing hospital beds to take care of patients patients with COVID-19. So there were more hospital beds available to take care of people with COVID-19, and we never ran out of hospital beds or ventilators. And then over the summer, our COVID-19 cases went down, and so did hospitalizations. But again, in the winter, you can see that as our COVID-19 cases increased, and we had a surge. Also, the number of people admitted to the hospital also surged, and you can see that we even went, much higher, almost twice as much higher in hospitalization than we were even in the spring and the beginning of the pandemic. As our cases in the community of COVID-19 declined after our holiday surge in the winter, our hospitalizations also declined, and we were all really excited. However, unfortunately, recently in the last month, as we've started to see an increase of reported COVID-19 cases in the community, of course, we've also seen our hospitalizations from COVID-19 increase. So, that's very frustrating, but just also to emphasize, COVID-19 is not over. We still see a lot of people that fall ill with COVID-19. We still have cases in the community, lots of transmission in daycare centers, businesses, youth sports teams, in restaurants. So, we have to be vigilant wherever we go that is not within our own household. We have to be vigilant about wearing masks and socially distancing, and making sure if anybody is sick that they stay away from your space. Making sure we try to screen and making sure that people who are sick don't come into your space. So as we have our strategies to bring our COVID-19 numbers down, and we're hoping that their work. Of course, our main strategy right now is getting people vaccinated, and really this is a race against time. So it's vaccines versus the variants of concern of COVID-19. So we're hoping that the vaccine will win and our case numbers of COVID-19 will decrease, but we, I hope that everybody gets excited to get vaccinated. Now everybody is eligible who is 16 years and up. So I hope when you have an opportunity to make an appointment to get vaccinated, that you make that appointment and get vaccinated. It'll help you stay healthy, and it'll also help the rest of our community and bring down our COVID-19 cases and help us open up businesses again. So remember, it's the same old that these interventions we know have worked since the beginning of the pandemic. And we just have to keep going on. Hopefully, maybe just a few more months until enough people are vaccinated, where we start to see significant declines at COVID-19. So wearing a mask, maintaining your social distancing, avoiding large gatherings. At the health department, we're working hard to identify cases and putting them in isolation, and doing a case investigation and identifying close contacts and putting them in quarantine to reduce the spread of COVID-19 in our community. We're really trying hard to protect our high-risk groups. So we know our elderly, before we had the vaccine, and we really made sure that there were, people were looking out for them, doing grocery shopping for them, helping them get their medicines. A lot of grocery stores and pharmacies did delivery. And now we have the vaccine, they were the most important population, the first population to get vaccinated, because they were the most at risk of becoming very, very ill and dying with COVID-19. Again, vaccination is a very strong strategy that we have, making sure we wash our hands, postponing travel. I know it's kind of ironic to say that right now during spring break week, when probably a lot of people are out of town traveling, but we know that there is, as well as there is a lot of COVID-19 in Erie County, there's even more COVID-19 outside of New York State and outside of the United States. Much of Europe is locked down now. Canada, across the border, is locked down. So we just have to, think about delaying travel if we can. And then, of course, at the health department, we're doing the best we can with contact tracing and putting close contacts in quarantine. And then also we want to make sure that our healthcare workers are protected, both with physical health, being protected against COVID-19 transmission. And they were also a priority population to get vaccinated, but also with mental health. This has been so draining on everybody, especially our healthcare provider workforce. So, and New York State, and I know that many hospitals and medical systems have put systems in place to help our healthcare workers deal with this additional stress, which is like unbelievable. So just want to present some Erie County informational resources for everybody. As I mentioned earlier, we are, the Erie County Health Department is very focused on health communication. We want to make sure that that Erie County residents have the most up-to-date, accurate information about COVID-19 and everything, so that you'll be able to make smart choices. You'll be empowered by good information. And so this information on COVID-19 is available on our Erie County website at erie.gov/COVID-19. For people that can't find the information they're looking for on our website, or they prefer to get information by talking to people, we also have our COVID-19 information hotline at 716-858-2929. So I just want to just remind people that there is a lot of information out there around COVID-19 and just anything. And you have to be really, really careful about the sources that you use to get information to help you make decisions around your behavior. And so I can assure you that the Erie County Health Department has the most up-to-date information. Also, we know that our mothership of public health, the Centers for Disease Control and Prevention, they have very reliable, scientific, correct information, as well as the New York State Health Department. So if you get information from a blog or from a friend, it may not be informed, it may not be accurate. And if you use that inaccurate information to make decisions on your behavior, you could get in trouble. So you can wind out making some poor choices that can make you pretty ill. So please remember, just be very careful where you get your information. Get it from a credible source. Also, many medical professional organizations have good health information for their target population. So I'm a pediatrician. I know the American Academy of Pediatrics has a lot of great information around the health of children for families, and that's at healthychildren.org. Also, we have our COVID-19 surveillance information up on our Erie County website at erie.gov/COVID-map. And so we had a screenshot of that earlier. But we have the COVID-19 case counts, zip codes, and the municipalities where we're seeing the cases, so you can know where our hotspots are in Erie County, and you'll know if our numbers are going up or going down. And then also we have great information on our Erie County Health Department website around vaccine. And soon when we have our new vaccine appointment system in place, you'll be able to go to our website and make online appointments, as well as in addition to our call center where you're able to make appointments for vaccine. So we really want all Erie County residents to stay as up to date as possible with all health related information, especially with COVID-19. So the county executive and I do a press conference every Tuesday at 2 o'clock. It's on our Erie County YouTube site. Also, many of the media stations will live stream it. We also are putting out a lot of great information. My public information officer, Kara Kane, is putting out information on social media like all day, every day. She uses Twitter, Facebook, Instagram. So you can follow us on any of those social media accounts, and I hope you do. And because you'll get great information all day, every day. And then our Erie County Health Department website has information around COVID-19, and then a lot of other important public health issues like our opioid epidemic and our lead, and it's the warmer weather. It's starting to be Lyme disease season, so we have information about that. So it's a good site to look for good public health information, COVID-19 and beyond. So I've finished my talk. I don't know if we have time to entertain any questions before the end of our hour, or I could go over a little bit.
Well, thank you, Dr. Burstein. That was extremely informative. It was really a lot of great information, and we're going to make sure that those links are all available to people, because you're right. The Erie County Health Department website is chock full of information. And, you know, just like the health department, the library promotes very much good information. We always want to make sure that people are getting the right information. So we're also very willing to help out in identifying those things, identifying websites that may not be the information we should be looking, and directing people to the good information. So thank you so much. I don't know if there's any questions. We can check in the chat. I don't see anything. So why don't I ask a question?
Hi, this is Kara. We have a private question from an individual who's asking about when we might estimate when we'll get to herd immunity for COVID in Erie County, and how will we know when we are there?
So when the big question we're all asking is, when are we going to get to a place of herd immunity? I think we still have a few hoops to jump through before we can get there. First of all, we have to get a higher proportion of adults fully vaccinated. Right now we're at about 20% in Erie County, so we know we need much higher numbers than that. The public health experts, estimate we need anywhere from 75 to 90% of our population fully vaccinated. And so right now there's a key segment of the population that can't be vaccinated because there's no FDA authorized vaccines, and that's for kids who are 16 and under. So we're hoping that later this spring or in the early summer, the Moderna and Pfizer, and eventually J&J, they were a little bit behind, but eventually they will all have approval by the FDA under emergency use to vaccinate kids that are 12 and up. So we'll have part of our childhood segment fully vaccinated, hopefully by the time school starts. And then we know the vaccine, the pharmaceutical companies are also doing studies now, phase 2, phase 3 clinical trials, looking at vaccination for children as young as 6 months of age. So and we think we have to, we know that we need more adults vaccinated. We also need to wait for vaccines to become available for the children in our community, I think, before we can, safely reach herd immunity. However, the good news is looking at examples in other countries where they've been successful in vaccinating, and that's actually been Israel. They started, it's a much smaller country, and so it's easier for them to reach their entire country's population. But they were very aggressive from the very beginning, as soon as Pfizer Pharmaceuticals knew that they had an effective vaccine, of procuring and purchasing that vaccine, enough vaccine for every Israeli resident. And they've been very aggressive and giving a lot of incentives and for people to get vaccinated, and disincentives for people who are not vaccinated. And they have pretty high vaccination rates. It's not where we would look at herd immunity. I think they have about 40 or 50% of the country that is vaccinated right now. And even with that number, they're seeing their case rates plummet. And they're able to open up more businesses and schools. So hopefully when we can get to even doubling the proportion of Erie County residents that are fully vaccinated, we'll see some good effects of decreasing number of cases of COVID-19. So it's it's not just as simple as an estimated date. There are certain hoops that we have to jump through that we have no control over. We know that there's still also a segment of the population that is questioning vaccines, and we hope that if somebody in your life that is questioning the safety and effectiveness of COVID vaccine, is you can be a spokesperson for the health department and and give them great information. You can look at our Erie County Health Department website around vaccine vaccine information or go to the CDC's website. They have a lot of great information, and educate yourself on vaccines, and be a thought leader, and help your friends, show by example, get vaccinated, and help your friends understand how important vaccination is, and help them to understand that they will also want to get vaccinated.
So this is Kara again. Another one sent to me privately is, do you think that we'll need booster shots in the coming months or years for COVID-19 vaccine?
Well, so the question of will there be booster shots for COVID-19? Eventually there will be, and we know that the pharmaceutical companies are already working on studying how to make booster doses that take into account the new circulating variant strains. With the mRNA technology, it's easier for them to to pivot and change the formulation of their vaccine. And hopefully it'll be a much faster process than what we currently have now with the flu vaccine. So we do know that because of the COVID-19 virus is an RNA virus, it replicates very, very quickly. And because it replicates very quickly, it's also a sloppy replicator, so it makes a lot of mistakes. Sometimes the mistakes don't help the virus, so the mistakes kind of fall out in the evolutionary process. However, sometimes the mistakes actually help the virus become more transmissible or make it more deadly. And so that's what we always have to be worried about with these RNA viruses, which COVID-19 is an RNA virus. So we know that with as long as we have COVID-19 in our community, we will see these emerging variant strains. So we know that we will need a vaccine to cover these strains because they could be different enough that the vaccine may not be as effective eventually. So so we know that we will need booster doses. But we don't know when we will need them and when they will be available. It may not be just an annual booster dose like the flu vaccine. With the new vaccine technology, we may see like a certain level, high level of variant strains in the community, which the current vaccine may not be protective against. So, hopefully the pharmaceutical companies can pivot, get that information, develop a booster that would protect against those variant strains. And then we'd hopefully they may be able to manufacture it in a timely fashion, and we'd be able to deliver that to the community. So, we're not really sure when we will receive, when we will need to have booster doses, and the frequency and the timing of their delivery. So that's to be continued.
I think that's it. And Mary Jean, we're going to ask you to wrap it up.
Thank you very much. Again, thank you, Dr. Burstein. A whirlwind of information. We are so excited that you were able to be with us today. And thank you again for all that you are doing in the community. It is National Public Health Week. So we want everybody to stay healthy. Make sure you're wearing your masks. I know, Dr. Burstein, that's something that you promote very regularly, is that everybody should always wear their mask when they're out in public. Get a vaccine. And for those of you who may not know, we have several libraries that are assisting people in getting those appointments. And so we're looking forward to getting the information on the county's website and hotline to get that information out to people who come to us and ask, how do I get a COVID-19 vaccine? So people should just check out our website at www.buffalolib.org and absolutely 100% take a look at all of the information that is on the Erie County Department of Health website, and make sure that you're getting the information from those good resources. Again, thank you everyone for being with us today. This has been recorded. It will be placed on our Facebook as well as the YouTube channel. I wish everyone a happy and healthy afternoon. Thank you very much.